The best leaders are not those who are always telling other people what to do, but they are listening, following, and really the goal is to create a number of other leaders. When I'm a leader of my team, I want every team member to act like they're a leader.
When you work 5 days a week, the people you work with become your family, and the people here are great, so I'm honored to call them my family. We always want to have your family's best interest in mind, so our family always wants to take care of your family.
I have some family in New Jersey, and I found out that the level of care you get in Manhattan is so different than the level of care you get in New Jersey. So this is where I wanted to truly come and make a difference, and that's why I decided to come and form Apex Heart and Vascular in the truly the urban areas where most help was needed.
Being with Dr. Shah, working with him, it's amazing. I remember the first time I walked into the room with him and one of his patients, he literally lit up the room. He's always trying to make the patient feel like they're at home. He always tries to answer their questions to his best ability. While being at Apex, I do feel like I'm learning every day just because with different patients, you have to accommodate them differently.
I think it's super important to make sure that our patients are educated on what we're doing and why we're doing it. It's important to make sure that they're aware of why we're ordering a certain test, what that test is going to show us, and then how the results come out and what they mean and how we're going to treat that and act on that. And if they have a better understanding of that, I feel like then our patients have, more motivation to be proactive about taking their medications or coming in for that appointment for that specific test. So I feel like the education component is crucial.
Everything that we do here should be a discussion with you part of that discussion. So we never want to force any treatments or testing upon you until you fully understand what's involved.
So in my opinion, patient care, it really comes down to competence and compassion. Competence meaning you have to be good at what you do, and not just once or twice or occasionally, but every time, every scenario. When you are seeing a patient in any clinical setting, be the best version of yourself. Study, learn, be up to date with newer guidelines, newer therapies. The science continues to evolve, and you gotta keep updating yourself. You learn the science of medicine and you apply it. But you also need the compassion, because if you don't have the compassion, if you don't have what it takes to hold a patient's hand and make them feel good about themselves and give them hope and show them the path on which they have to walk or they should walk, and walk with them if needed, then you are really not a great provider.
Every day some things seem routine and we feel like we're just, providing maintenance and preventative health, but there are some days where we're making an even bigger difference than that and saving someone's life. And when I came to that realization a few weeks ago, it reminded me of all the reasons why I went into this field in the first place.
Put your heart in our hands.
Pon tu corazón en nuestras manos.
आप आपका हृदय हमारे हाथ में दीजिए, हम उसकी पूरी हिफाजत करेंगे.
Put your heart in our hands.